Dictionary definitions of posture refer to the way a person positions their body. Most of us do this without thinking and alter our position as often as necessary, depending on what we're doing or how comfortable we are. 24-hour postural management is ensuring a person is positioned well all day, every day, and includes lying, sitting and standing. Here's a quick test. I'd like you now to stay exactly where you are. Don't move at all. Are you still comfy? Is that an itch on your nose you can't scratch? Do you need to wriggle yet? How did that feel? Can you now imagine being in the same position for several hours? Many people with neurological conditions will need assistance to position themselves correctly or to change position. Some people will also need equipment to help support them in the correct posture. If a person is not properly supported in a position, they may not be able to function or carry out tasks. This could include any kind of activity from sitting up and making eye contact to standing in the kitchen to make a meal. Spasticity can make a person's muscles pull their body into asymmetrical positions, which, if not corrected, can lead to permanent postural deformity. This can then affect the way the person is able to lie, sit, stand, perform activities, their level of comfort, or even their ability to eat or breathe properly. Lying in an asymmetrical position can affect the way a person sits and stands during the day. It can also change the shape of the person over time, flattening someone into a shape where it becomes impossible to sit or stand. Lying with legs to one side will make it difficult to sit with straight legs. This can then put pressure on hips and knees, potentially causing pressure sores on these areas, or it can pull the trunk out of a good position. Lying with the knees out to the sides will make it difficult to bend at the hips in the morning. This can cause pain and make it difficult to sit upright in a standard chair. Lying with a sideways bend in the back will make it difficult to sit up straight during the day. This can put pressure on one side of the body, potentially causing pressure sores. It can also make the person feel very unstable if leaning, or even affect breathing if the lungs are compressed. Lying with knees together and feet out will make it difficult to stand up. This can affect mobility and even affect other activities such as getting washed and dressed if the knees press together so tightly they cannot be separated easily. Lying curled up will make it difficult to sit up straight and lift the head during the day. This can make it hard to sit in a standard chair and also means it can be difficult for the person to swallow food and drink or even make eye contact with other people. Some people with neurological problems may spend long periods in bed. Positioning them correctly is important, especially if that person cannot move themselves, as they need to be comfortable and supported. Some people will be able to lie in a standard bed with no problems. Others may need pillows to support them, and some might need a sleep system to support them fully when lying down. A sleep system is a collection of shaped brackets and wedges, or cushions, individually designed to support a person in a particular way. The position of these supports is crucial to maintaining that person's posture. Guidance should be given by a specialist, most likely an OT or a physio, in how to position these supports for that individual. And these should not be altered without advice from the person who wrote the guidance. Regular changes in position are also important to prevent pressure sores, discomfort, or becoming fixed in one position. Sitting in a poor position will affect your comfort and posture. If left for a long time, the body will eventually become fixed in a sitting posture, making lying and standing difficult or even impossible. Sitting in a chair that is too wide will make someone lean to the side. This can cause the spine to become misshapen and can put pressure on hips, elbows and ribs, potentially causing pressure sores on these areas. Sitting in a chair that is too narrow will put pressure on the hips and thighs and possibly the trunk, again potentially causing pressure sores. A seat that is too low will mean that someone's knees are not resting on the seat properly. This will put a lot of pressure on the bottom, potentially causing pressure sores, and could cause pain in the hip and knee joints. This can also make it difficult for a person to stand up from the seat. A seat that is too high will not support a person's feet properly, especially if they're left hanging. This will put more pressure under the thighs, again potentially causing pressure sores, and can pull the person forward in the seat out of a good sitting posture. Armrests that are too high will cause someone to hunch their shoulders, and too low will cause them to slouch forwards to rest their arms. Sliding forwards in the seat will cause someone to sit with a curved back. This will have a similar effect as lying curled up. Sliding can also cause friction and shearing to the bottom and thighs, which can damage skin. Incorrectly fitted lap belts can also cause damage to soft tissues or even restrict breathing if someone slides under the belt. Making sure someone sits correctly is very important. The best position is usually with the bottom right at the back of the seat and in the middle of the chair. Making sure someone sits correctly is very important. The best position is usually with the bottom right at the back of the seat and in the middle of the chair. If the person uses a pressure relieving cushion, it's imperative that this is the correct way round in the cover and in the seat to be effective. They will usually be labelled to make it clear which way round they go and which way up. Some chairs may have extra supports, such as lateral supports at the side of the trunk or a head support. These supports will have a specific position set by a specialist, usually an OT or a physio, in order to fully support the individual, and they should always be set correctly. Sometimes people will require belts or harnesses to support them in the seat. These must be tight enough to support them and maintain the correct position, without being too tight to cause pressure areas and discomfort. Some people may have a chair that tilts in space. This means that the whole seat will tilt backwards rather than just the backrest reclining. A general rule of thumb is that a backrest should never be reclined unless the seat is tilted, as this would encourage the person to slide forwards out of the seat. The tilt function can be used to alter a person's position for different activities, such as sitting upright for feeding or tilting back for rest periods. The tilt function can also be used to change a person's pressure areas if altered regularly and help increase the level of support the chair offers, as it will require less effort from the individual to maintain a sitting position if tilted back. If someone is hoisted for transfers, then the seat can be tilted back during the transfer to enable the person to be positioned well back in the chair. Some chairs can also be tilted forwards to help a person who is completing a standing transfer to get up from the seat. Standing can help with maintaining the health of a person's bones, their bladder and bowel function, their strength and range of motion, as well as altering their position for pressure area care and social interaction. But it can also be hard work for people if they have a neurological deficit, and they may need equipment to help them. This could be a walking stick or a frame for a little bit of support, or a tilt table or standing frame if they're unable to stand by themselves. Some people may only be able to stand for a limited length of time before they become tired, at risk of falling, or too uncomfortable. However, standing may not be possible if someone's posture has not been correctly maintained in lying and sitting, as any severe postural deformities may prevent this. Making sure someone lies and sits correctly is the most important thing that can be done, as this will enable those people that can stand to do so more easily. If someone uses equipment, then this needs to be available to them whenever they stand, and should never be placed out of reach if a person is capable of standing by themselves. If an individual uses a tilt table or a standing frame, then there is likely to be very specific guidance in place on how much support the person needs and where this should be placed. This guidance should be followed and not altered without discussion with the specialist. This is likely to be a physiotherapist. Someone using a tilt table or standing frame is likely to only be able to stand for a certain period of time in that equipment, and should be transferred out within the specified time frame so as not to cause discomfort or pain or problems with spasms or even dizziness from standing too long. In summary, 24-hour postural management is ensuring a person is positioned well in lying, sitting and standing all day, every day. It is different for every individual and should take into account that person's physical condition, their level of comfort and level of function. Some people can be properly positioned in standard beds and chairs. Some will need pillows or cushions. Others will need bespoke sleep systems, customised seats or even standing frames. Even when fully supported in a good position, an individual will still need to be repositioned regularly to maintain their comfort and pressure areas. And remember, the position of supports in any postural management system, such as harnesses, lateral pads or headrests, must never be changed without advice from the specialist that prescribed the equipment, as they are critical to the health, comfort and support of that person.